Autoimmune pancreatitis. Autoimmune pancreatitis, AIP, is a chronic inflammation thought to be caused by the immune system attacking the pancreas and responding to steroid treatment. Two types of AIP are now known, type 1 and type 2. Type 1 AIP is a manifestation of a disease called IG4-RD. The disease usually affects many organs including the pancreas, the bile ducts in the liver, the salivary glands, the kidneys and the lymph nodes. Type 2 AIP appears to affect only the pancreas, although about 1/3 of people with type 2 AIP are associated with inflammatory bowel disease. Type 1 AIP can be mistaken for pancreatic cancer. These two conditions have different signs and symptoms, but there are very different treatments, so it is very important to distinguish one from the other. Symptoms: autoimmune pancreatitis, AIP, is difficult to diagnose. Usually, it does not cause symptoms. Signs and symptoms of type 1 AIP are similar to those of pancreatic cancer. Signs and symptoms of pancreatic cancer can include black urine, pale linen or chairs floating in the bathroom, yellow skin and eyes, jaundice, pain in your upper abdomen or middle part of your back, nausea and vomiting, weakness or extreme fatigue, loss of appetite or feelings of fullness, weight loss for no apparent reason. The most common symptom of type 1 AIP, which is present in about 80% of people, is painless jaundice, caused by blocked bile ducts. Type 2 AIP can present with recurrent episodes of acute pancreatitis. Pain in the upper abdomen, a common symptom of pancreatic cancer, is often absent from autoimmune pancreatitis. The differences between type 1 and type 2 AIP are: in type 1 AIP, the disease can affect more organs than the pancreas. Type 2 AIP affects only the pancreas, although the disease is associated with another autoimmune disease, inflammatory bowel disease. Type 1 AIP mainly affects men in 16 to 7 years of life. Type 2 AIP affects men and women equally and has a lower initial age compared to type 1 AIP. Type 1 AIP is more likely to recur after treatment is discontinued. When to see a doctor: autoimmune pancreatitis often does not cause symptoms. See your doctor, however, if you experience unexplained weight loss, abdominal pain, jaundice, or other signs and symptoms that are bothering you. Causes: doctors do not know what causes autoimmune pancreatitis, but like other autoimmune diseases, it is thought to be caused by antibodies that attack healthy tissues. Risk factors: two types of AIP occur at different frequencies in different parts of the world. In the United States, about 80% of people with autoimmune pancreatitis have type 1. People with type 1 autoimmune pancreatitis often. They are over 60 years old men. People with type 2 autoimmune pancreatitis, it is usually over 40 years, 1 or 2 decades younger than those with type 1. She can be as feminine as a man. It is more likely to have inflammatory bowel disease, such as ulcerative colitis problems. Autoimmune pancreatitis can cause a variety of problems. Pancreatic exocrine dysfunction. AIP can affect the ability of your pancreas to make enough enzymes. Signs and symptoms can include diarrhea, weight loss, arthritis, and a lack of vitamins or minerals. Diabetes. Because it is secreted by the insulin-producing organ, its damage can cause diabetes and you may need to be treated with oral medication or insulin. Pancreatic stiffness and bile duct counting. Pancreatic stones or stones. Treatment of autoimmune pancreatitis, such as long-term steroid use, can also cause complications. However, even with these problems, people treated for autoimmune pancreatitis have a normal lifespan. There is no established relationship between AIP and pancreatic cancer,